All right, Medicare. It's one of those things that can feel like a giant puzzle, especially as you get closer to 65.
Yeah, it really can be. It's a whole new world of healthcare and insurance.
That's exactly why we're doing this deep dive today, to break it all down, make it a little less overwhelming for everyone.
Exactly. Arm you with what you need to know.
So by the end of this, you'll feel confident about, stepping into this new phase, whether you're right on the cusp of 65 or just starting to think about it.
Absolutely. Little planning goes a long way.
We're going to cover some really important stuff today, like who's eligible for Medicare when you hit 65, that super important initial enrollment period we always hear about.
Can't stress that one enough.
Seriously. And then what to do if you're actually still working past 65,
Yeah,
because that throws a whole other wrench in things, right?
it sure does. Lots of different scenarios to think about.
Oh, and here's a little fun fact to kick things off.
Hmm.
Did you know that if you're already getting those Social Security benefits, you're automatically enrolled in Medicare Part A and Part B?
It's true. Saves a step for some folks.
Right. Okay, let's jump in. So eligibility. I think most people just assume that once you hit 65, boom, you're in, right? Medicare City.
You'd think so, wouldn't you? But there's a little more to it. Like, most people do become eligible at 65. That part's true. But you gotta have worked, like actually worked for at least 10 years to get that sweet premium-free Part A, the hospital insurance part.
Yeah, that makes sense. But wait, what happens if like someone hasn't worked for 10 years by the time they're 65?
Mm.
Like they took time off to raise kids or, I don't know, travel the world or something.
Well, they can still get Part A, but they might have to pay a premium for it. And that's why it's so important to like check your work history, make sure you've got those credits, because, no one wants a surprise bill.
Right. Talk about a birthday bummer. So
Huh.
that's Part A hospital stuff. But what about the rest of it?
Well, that's where the other parts come in. You've got Part B, which covers things like doctor's visits, outpatient care, that kind of stuff. And then there's Part D, which is all about prescription drug coverage.
Okay, so Part A, Part B, Part D. Got it. But you know what always trips me up? That whole initial enrollment period thing. Everyone throws around the acronym IEP.
Right.
Dude, what does it actually mean in like plain English?
Think of it like this. It's a 7-month window that surrounds your 65th birthday. And this is when you got to make all the big decisions about your Medicare coverage, where parts you want, what kind of plan you want.
It's so like, is it 3 months before my birthday, the month of my birthday, and then 3 months after?
You got it. That's your IEP. And the reason it's so important is because if you miss this window, you might have to pay late enrollment penalties.
Yeah.
And nobody wants that, right?
No, not at all. Especially on top of everything else you're already dealing with, in life. So calendars out, everyone. Mark that 7-month window. But hold on, what happens if you're like the birthday rock star who's still working when they turn 65?
Yes, the working wonders. Well, if you've got health insurance through your job and your employer has 20 or more employees, you can actually delay enrolling in Part B without those pesky penalties.
So like if I'm feeling good with my work coverage, I can just kind of hit pause on Medicare Part B.
Pretty much. But here's the thing. You got to keep an eye on that work situation. Because if something changes, like say your company downsizes or you decide to switch jobs, you got to jump on that Part B enrollment during a special enrollment period. Otherwise, you guessed it, penalties.
Ugh. Medicare is like a game of chess. You always got to be thinking a few steps ahead.
You're telling me. But it's worth it to get it right. Now, on top of all this, we've got Medicare Advantage and Medigap plans. It can feel like alphabet soup.
Seriously. Can you break those down for us a bit?
All right, so Medicare Advantage, or Part C, is kind of like an all-in-one package. It's offered through private insurance companies, and it bundles your Part A, Part B, and often Part D coverage. Plus, they might throw in some extras like vision or dental coverage.
Oh, that sounds like way less complicated.
It can be. But then you've got Medigap, which works alongside Original Medicare. That's Part A and Part B. And it helps cover some of those out-of-pocket costs that Original Medicare doesn't. Think deductibles, co-payments, things like that.
So like it's supplemental?
Exactly. And there are different Medigap plans out there. Each one's got different levels of coverage, so it's all about finding the one that fits your needs and your budget.
Okay, so it's like building your own personalized healthcare plan.
You got it. And that's why this whole decision-making process around 65 is so important. You got to think about your health now, any medications you're taking, how much you can afford to spend, and what kind of care you might need in the future.
Whew, that's a lot to consider.
It is, but it's your health, and it's worth taking the time to make sure you're covered.
Couldn't agree more. So we've covered eligibility, that crucial IEP window, what to do if you're working past 65, and all the different parts of Medicare, even the Advantage and Medigap options. What's the, biggest takeaway you want people to leave with today?
I'd say the most important thing is to plan ahead. Don't wait till the last minute to figure this stuff out, because the more prepared you are, the better decisions you'll be able to make. And that's what it's all about, right? Making choices that give you peace of mind when it comes to your healthcare.
Absolutely. So to everyone listening, if you're getting close to 65 or even just starting to think about Medicare, I have a little homework assignment for you.
Oh, I like this.
Think about your current health coverage, your work situation, and your own personal needs when it comes to healthcare. Do a little research, ask questions, and you need help sorting it all out. There are great resources out there, like Diversified Insurance Brokers, who can provide personalized guidance.
They really can. Don't be afraid to reach out and ask for help. It's a complicated system, but you don't have to navigate it alone.
You've got this. We believe in you.
Mhm.
Until next time, stay informed, stay healthy, and keep on rocking.